Hi everyone, my name is Maggie Angel, and I am doing the risk factors. So for the risk factors for multiple sclerosis, the disease process has an unknown etiology. It is believed that an autoimmune inflammatory disorder causes damage to the myelin and peripheral nerves, and that this response could potentially be triggered by genetic predisposition, a viral or an infectious process, trauma, or exposure to heavy metals. For Guillain-Barre syndrome, or GBS, I hope I said that right, it occurs after an infectious disease. Most people have a previous infection of the upper respiratory tract, or they have gastroenteritis before developing this. Some common pathogens that result in GBS are C. jejuni, CMV, Epstein-Barr virus, and Mycoplasma pneumonia. GBS has also been known to occur after immunizations with various types of vaccines.
This slide will be discussing the manifestations of both of the diseases. The first disease is multiple sclerosis. These individuals will have weakness, numbness, tingling, balance problems, vision problems, ataxia, tremors, pain when they move their eyes. Sometimes they often have difficulty walking or coordination with certain tasks. Some individuals will have urinary or fecal incontinence, sexual dysfunction. Sometimes they will have depression, dehydration due to the impaired swallowing. They're at a higher risk for aspiration, UTIs, and kidney infections. These individuals will often have impaired recent memory, attention spans are impaired, and these symptoms can last for weeks or months, and they'll often occur every 3 years. Their symptoms will return back to a normal state or almost normal state. And then there is Guillain-Barre syndrome. These are symmetric muscle weaknesses. They'll have absent or depressed tendon reflexes, paresthesia, or numbness and tingling. They'll have mid-weakness, which causes them trouble walking. They'll often have nearly or complete paralysis of their extremities and respiratory muscles, which can lead to artificial ventilation. They have acute inflammatory demyelinating polyneuropathy, which is a very unique characteristic for this disease. It's causing lower and upper limb muscle weakness in the trunk, cranial nerve weakness. They will often have tachycardia with periods of bradycardia, hypertension with periods of hypotension, urinary retention, ileus, and then often no sweating. These are quick manifestations over a few days and then break after about 4 weeks.
Hello, my name is Adam Schiller, and today I'm going to be talking about the complications associated with being diagnosed with either multiple sclerosis or Guillain-Barre syndrome. Starting with multiple sclerosis, patients diagnosed with MS are at increased risk for major depression as a result of how impactful the disease can be upon their lives. It's said around 50% of those diagnosed with MS do develop some form of depression. Additionally, around 45 to 65% develop some sort of cognitive impairment, such as reduced recent memory, impaired abstract thinking, reduced attention span, and reduced visual spatial perception. Patients are also at risk for dehydration and malnutrition as a result of the difficulties swallowing or their inability to care for themselves as a result of the disease. Likewise, because of their difficulty swallowing, patients are at risk for aspiration and thus aspiration pneumonia. Patients are also at risk for urinary tract and kidney infections as a result of urinary retention and urinary sphincter dysfunction associated with the disease. After several decades, the patients are also at risk for developing something called secondary progressive MS. And with secondary progressive MS, patients typically have continually and progressive deterioration to the point where they are disabled. Additionally, patients who are taking medications to help control their symptoms with MS, such as the use of immunosuppressants and corticosteroids, which are two of the more popular kinds of medications used to treat this disorder, they're at risk for developing adverse effects as a result of those medications, such as nephrotoxicity, hypertension, hyperlipidemia, pharyngitis, dry mouth, and even infection. Um, Now, moving on to Guillain-Barré syndrome, patients who have untreated or undiagnosed GBS are at risk for life-threatening consequences as a result of neuromuscular respiratory failure. Patients are also at risk for deep vein thrombosis, DVT, as a result of a more sedentary lifestyle caused by the weakness that they experience from the disease. And they're also at risk for developing psychological problems related to their weakened state and how impactful the disease can be upon their lives. Um, Similarly, they're also at risk for adverse reactions associated with the various drugs that they take to help control their condition, which include similar drugs as those of used to treat MS with the immunosuppressants and corticosteroids, which do leave them at risk for pharyngitis, dry mouth, hoarseness, nephrotoxicity, and increased risk for infection.
Therapeutic, holistic, collaborative care. It's important that as nurses that we understand that we will be.
My name is Bailey Belser, and I'll be discussing the psychosocial impacts of multiple sclerosis and GBS. In MS, it affects cognition and emotion, so complex attention, speed of information processing, planning and prioritizing, visual perceptual abilities, and word finding will all be altered, and all of these alterations can really affect the ability to have a job, socialize, doing ADLs, and just overall quality of life. Emotionally, there's significant tissue damage that MS causes in the brain, and this leads to significant emotional changes, specifically depression, but there's also anxiety and grief that comes along with it as well. For GBS, there's a decrease in self-esteem, depression, there's anxiety, decision-making conflict, there's a lack of confidence, social functioning is altered, an inability to understand risk-taking, and social conformity is also altered as well.
Hi, my name is Alyssa McElroy, and I'm going to be talking about the community resources for multiple sclerosis and Guillain-Barré syndrome, or GBS. They both have support groups that can be found locally, online, and nationally, so people who have been diagnosed with these disorders can go to those support groups and talk to people who have also been diagnosed. MS also has the National MS Society, and their vision is to have a world free of MS, and their mission is for people affected by MS to be able to live their best lives as they stop MS in its tracks, restore what has been lost, and end MS forever. There's also the National Institute of Neurological Disorders and Stroke, and their mission is to seek fundamental knowledge about the brain and nervous system and to use that knowledge to reduce the burden of neurological disease. So the National Institute of Neurological Disorders and Stroke isn't just for MS, but it's encompassed within that entire organization. For GBS, there are also similar support groups, as well as the GBS Foundation, which is international. Their vision is that every person affected by GBS, CIDP, or related syndromes will have access to early and accurate diagnosis, appropriate treatment, and knowledgeable support services, utilizing the mission that they improve the quality of life for individuals and families affected by GBS, CIDP, and related conditions. Our unwavering commitment to the patients we serve is built on 4 pillars: support, education, research, and advocacy.
Hi, this is Rudy, and I'll be going over the two concept maps. So let's start with multiple sclerosis. While we don't know the etiology of multiple sclerosis, we do know that it is an autoimmune disorder in which the T cells attack the myelin sheath of the nerve cells. And because neurons are so highly myelinated, they are often attacked first, or at least the symptoms occur there first. Those symptoms include temporary vision loss or distortion in one eye, impairment in color, pain with eye movement, blurred vision. Other symptoms include numbness, tingling sensations, ataxia, weakness, and fatigue. As the disease progresses, there are other symptoms occur, which include severe motor damage, resulting in hemipharesis, paraparesis, or quadriparesis, dysphagia, which leads to dehydration, malnutrition, and a risk of aspiration pneumonia. The loss of recent memory, loss of abstract reasoning, greater inattention, impaired visual spatial perception, and urinary and fecal incontinence and sexual dysfunction. Perfusion is not affected by multiple sclerosis. Like multiple sclerosis, Guillain-Barre syndrome is an autoimmune disorder in which antibodies attack the myelin sheaths of nerve cells. However, it is a post-infectious disease, which means that it occurs after the infection of another disease. Its symptoms include absent or depressed deep tendon reflexes, paresthesias and numbness, ascending paralysis, which causes difficulty walking, and once it gets high enough, potential paralysis of respiratory muscles requiring artificial ventilation, along with progressive, usually symmetrical weakness and fatigue. In 70% of patients with AIDP, which is a form of Guillain-Barre syndrome, there is an occurrence of urinary retention, ileus, loss of sweating, tachycardia fluctuating with bradycardia, and hypertension fluctuating with hypotension. Cognition and nutrition